So welcome to our show today for Chitkara News, and today we have with us Dr. Meenakshi Bhushan. Hello ma'am.
Hello.
And she is going to tell us about the latest viral cancer that we say, that cervical cancer, which is being spread in women and it has become famous due to Poonam Pandey's campaign. So hello ma'am, and my first question to you today is what inspired you to become a gynecologist firstly?
What inspired me? I always wanted to become a doctor, and during my MBBS times, when I saw deliveries happening here and there, and I saw a lot of women suffering from different diseases, and women are the most neglected part of the society. So I thought of serving them and becoming a gynecologist.
Okay, so how do you stay updated with the latest advancements in the field of gynecology?
For this, we have regular conferences which we call as continuous medical education system, where we have various educational programs at the state level, at the national level, and at international levels, which one has to attend compulsorily.
Okay, ma'am. So, how do you approach the patient's care and their communication system?
I work in a civil hospital, so it's like every day we have a OPD of around 100 to 150. So basically I am into gynae cancers now. So we advertise the symptoms and signs of various diseases, various cancers, and we educate and aware the patients to come to the OPDs and show whenever they are having any such kinds of symptoms.
Okay, ma'am. So, I think that you might know that most of the problems that the girls face these days is PCOD and PCOS. So, how do you ask the girls to prevent from suffering PCOD?
See, PCOD is a disease which is a kind of it's not curable exactly, but we can prevent its symptoms by changing or by modifying our lifestyle. So we always suggest the girls to have their weight under control, maintain BMI, and to have a healthy lifestyle. Avoid junk food, avoid outside food, regular exercise, and avoid stress, yoga, meditation, to stay away from menstrual issues like PCOD and other problems.
Okay, ma'am. So, I would like to ask that does PCOD or PCOS have a direct impact on cervical cancer?
No, they don't have any impact on cervical cancer. But yes, PCOD might be associated with other diseases in future. Suppose a girl who is suffering from PCOD is a very high risk candidate for diabetes in future.
Okay.
Or for hypertension in future, because it is basically a hormonal imbalance.
Okay.
So it's not related to cancer. Yes, but in a way, like if a girl is suffering from PCOD and she gets married and she wants to conceive, and we give her some drugs to conceive, then they are like there are studies that they are a cause of ovarian cancers, not cervical cancer.
Okay, ma'am. How do you handle high risk pregnancies or complications?
High risk pregnancies and complications, for that we are this institute is equipped with an ICU with anesthesia support throughout 24/7. We have our OT operation theatre functional. So that is how we have our staff nurses. We have a lot of support staff. So that is how we manage high risk cases here.
And how do you promote women's health and wellness in your practice?
See, whenever a woman is coming to you, if you see that she is overweight, so along with treating her symptoms, it is your duty to educate her regarding her diet and the importance of exercise in her this thing. If somebody is coming with some sexual complaints, it's always better to talk with both the partners and educate them, regarding the personal hygiene and sexual hygiene. So that is how I think we can create awareness. If somebody whose mother died of cancer, it is always better to educate that lady, her daughter, regarding the chances of cancer in her also.
Okay, ma'am. How do you address mental health concerns in patients?
Mental health concerns, it's a difficult part in a civil hospital where there is a heavy OPD, but to some extent it is like you can be empathetic to the patient, you can give them examples, like somebody suffering from CA breast can be given example of some celebrity, if somebody suffering from endometriosis can be given example of Katrina Kaif and like how they fought with the disease, and that is how we try to boost up their morale.
Okay, ma'am. And what is your approach to cervical cancer screening and its prevention?
Approach is like there are various screening methods. The basic screening method which we use here is a pap smear. That's a simple smear from the cervical cells, and it's a OPD procedure. So we encourage all the women who are sexually active or beyond the age of 21. We tell them to get this pap smear done every year. Like if 3 pap smears are negative consecutively, then it can be done in every 3 years. So that is how we tell them. There is a better method which is used in higher institutes like PGI, that is liquid based cytology. That is a better method than pap smear. This is also one of the methods. And if we find that there are symptoms of cervical cancer, then we directly go for biopsy, cervical biopsy.
Okay, ma'am. And how often do you recommend pap smears and HPV testing?
See, HPV testing is recommended every 5 years. Pap smear is recommended every year, but if it comes to be negative for consecutively 3 years, then every 3 yearly.
Okay, ma'am.
And HPV every 5 yearly.
Okay, ma'am. And can you discuss the importance of HPV vaccination in preventing cervical cancer?
Yes. It is very effective method. I would say like all the girls between the age of 9 to 15 years should be counseled, should be made aware that if they take 2 doses of vaccine 6 months apart, it is almost 99% effective in prevention of cervical cancer. So all the girls who are in that age group should take 2 doses, and ladies beyond that age should take 3 doses. Like first dose is given, if the first dose is given today, then the second dose is given after 2 months, and the third dose is given after 6 months of the first dose. So it should be it is going to come in our national immunization program also, and it should be incorporated, and all the women should get themselves vaccinated against cervical cancer.
Okay, ma'am. And how do you diagnose the cervical cancer, and what are the staging criteria for the same?
Diagnosis is basically through various methods like clinical examination. When you see any growth on the cervix, when the patient comes to the OPD and you see some growth on the cervix, that is one method. The second one is we take help of the radiological investigations like ultrasound, CT, MRI. Then we also go for histopathological examination. That is, we take a piece or a biopsy from the growth and we send it for examination. So that is how we diagnose cervical cancer. And staging is depending upon the spread of the cancer. Like if it is only in the cervix, it is stage 1. If it is involving the other parts of the uterus, it is stage 2. If it is involving the lymph nodes, it is stage 3. And if it is involving the other organs, then it is stage 4 in short.
Okay, ma'am. And how do you manage cervical cancer recurrence?
Cervical cancer recurrence is managed basically not by surgery. It is more managed by radiotherapy. Like it is more of a radiotherapy. The radiotherapists take care of it. But the prognosis is not very good in cases of recurrence of cervical cancer.
Okay, ma'am. And what birth control options do you recommend and why?
Birth control options, like depending upon the need of the patient, you have to see. First, you have to give the choice. You have to tell the pros and cons of all the methods. The patient is given cafeteria choice whether what method she wants to go for, and then you can recommend which one is best for. Like somebody who has never had a child, you can't give her the option of copper T. You have to give her the option of pills for birth control. Somebody who has had 2 children, has completed, or one child, and is willing to keep space between the 2, can be offered copper T easily. Okay. So that is how we counsel them. क्या हो गया? ज़्यादा टाइम हो गया?
नहीं स्विच करना
वो थक गई. And can you discuss your experience with reproductive surgeries?
Experience with reproductive surgeries, as in you're talking about deliveries?
Yes, ma'am.
So we have a surgery called a cesarean section, where if the baby is not, like if we are not able to deliver the patient vaginally, the baby is not able to come through the vagina, then you have to take a small incision around 10 to 11 centimeters on the abdomen of the lady, and then through the uterus you have to take an incision and take out the baby.
Okay, ma'am. And what measures do you take to ensure patient confidentiality and privacy?
It is we always take care that the consent is taken before the surgery or like before any procedure. We always make sure that no information is given to the patient's relative except her husband, that too with her own consent. And in the OPD also we always prefer seeing one patient at a time to maintain the privacy of the patient. We don't give any files or any details later on also without any orders by the civil surgeon. We don't give any details of the patient.
And ma'am, I would like to ask if you are involved in any of the technical research studies or clinical trials.
Presently, no.
Okay. And what educational resources do you recommend for the patients?
For the patients, we often give them pamphlets. We keep some programs here, cancer awareness programs in our Atal Cancer Center, and they can always come to a doctor and always ask their doubts, and they can aware themselves.
And ma'am, my last question to you for today would be, how do you incorporate telemedicine in your practice?
Telemedicine in today's, like what here in civil hospital what we are doing is telemedicine. By telemedicine, the physicians, they read the ECGs of the peripheral centers.
Okay.
Like if somebody is coming with chest pain, the ECG would be done at PHC level and a physician opinion will be given from civil hospital Ambala Cant. So that is how telemedicine is helping us. Also in cases of CT and MRI, where the CT and MRI are happening at different places, or if they are happening here and we want to take some expert opinion, so the radiologist can be in Bombay, Canada or anywhere, and we can send the films and take the opinion.
Okay, ma'am. Thank you so much, ma'am. It was great talking to you.
Thank you. Thank you.